guys, I hope you all are fit and fine. Welcome back to Science Screen. Today, we will discuss about malaria.
What is malaria? Malaria is a serious disease that spreads when an infected mosquito bites a human. Tiny parasites can infect mosquitoes. When it bites, the mosquito injects malaria parasites into the person's bloodstream. Malaria is a preventable and treatable disease that continues to have a devastating impact on the health and livelihood of people around the world. World Malaria Day, that is on 25th of April. World Malaria Day is an international observance commemorated every year on 25th of April and recognizes global efforts to control malaria. World Malaria Day 2022 will be marked under the theme Harness Innovation. How common is malaria? Malaria is common in tropical areas where it's hot and humid. In the United States, about 2,000 people get malaria every year. Worldwide, more than 220 million people get malaria annually. The majority of these cases occur in Africa and South Asia. Around 450,000 people die from the disease every year. Where does malaria usually occur? Malaria occurs all over the world, but it's rare in the United States. It's common in developing countries and areas with warm temperatures and high humidity, including Africa, Central and South America, Dominican Republic, Haiti and other areas in the Caribbean, Eastern Europe, South Asia, islands in the Central and South Pacific Ocean, Oceania.
People get malaria when an infected mosquito bites them. A mosquito becomes infected by biting someone who has malaria. The infected mosquito transfers a parasite into a person's bloodstream, where the parasites multiply. 5 types of malaria parasites can infect humans. In rare cases, pregnant women with malaria can transfer the disease to their children before or during birth. Very rarely, malaria can transfer through blood transfusions, organ donations and hypodermic needles. Malaria can occur if a mosquito infected with the Plasmodium parasite bites you. There are 4 kinds of malaria parasites that can infect humans: Plasmodium vivax, P. ovo, P. malariae, and P. falciparum. P. falciparum causes a more severe form of the disease, and those who contract this form of malaria have a high risk of death. An infected mother can also pass the disease to her baby at birth. This is known as congenital malaria.
What are the symptoms of malaria? Malaria symptoms usually appear 10 days to 1 month after the person was infected. Symptoms can be mild. Some people don't feel sick for up to a year after the mosquito bite. Parasites can live in the body for several. Signs of malaria are similar to flu symptoms. They include fever and sweating, chills that shake the whole body, headache and muscle aches, fatigue, chest pain, breathing problems and cough, diarrhea, nausea and vomiting. As malaria progresses, it can cause anemia and jaundice, yellowing of the skin and whites of the eyes. Diagnosis and tests. Malaria parasites can be identified by examining under the microscope a drop of the patient's blood, spread out as a blood smear on a microscope slide. Prior to examination, the specimen is stained, most often with the Gaines stain, to give the parasites a distinctive appearance. A rapid diagnostic test, RDT, is an alternate way of quickly establishing the diagnosis of malaria infection by detecting specific malaria antigens in a person's blood. How is malaria treated? Treatment for malaria should start as soon as possible. To treat malaria, your provider will prescribe drugs to kill the malaria parasite. Some parasites are resistant to malaria drugs. The type of medication and length of treatment depend on which parasite is causing your symptoms. Antimalarial drugs include artemisinin drugs, artemether and artesunate, atovaquone, Mapron, chloroquine, doxycycline, Doxy 100, Monodox, Oratia, mefloquine, quinine. What are the side effects of medications to treat malaria? Antimalarial drugs can cause side effects. Be sure to tell your provider about other medicines you're taking, since antimalarial drugs can interfere with them. Depending on the medication, side effects may include gastrointestinal issues such as nausea and diarrhea, headaches, increased sensitivity to sunlight, insomnia and disturbing dreams, psychological disorders and vision problems, tinnitus, seizures. Can I prevent malaria? Apply mosquito repellent with DEET, diethyltoluamide, to exposed skin. Drape mosquito netting over beds. Put screens on windows and doors. Treat clothing, mosquito nets, tents, sleeping bags and other fabrics with an insect repellent called permethrin. Wear long pants and long sleeves to cover your skin.
If you find this information useful, please leave comment and hit the like button. This encourages us to make more videos like this. On the basis of response to this video, I will make detailed information about this. Please comment your view. Thank you for your time.